Another area we can talk about on the lower face is this muscle. This is called the masseter muscle. It's a muscle of mastication, meaning when we chew and bite down, feel it stick out. Some women want more of a slender look to their face. So when we inject this muscle with Tox, it relaxes it so that it's not getting the heavier workout that a muscle normally would get when we chew and make that muscle active. When we inject that with Tox, this muscle relaxes, is less activated, and visually this becomes more slim. We don't really treat medical diagnoses at med spas, but just as an aside, I want to say that for medical reasons, people who grind their teeth, they get those same injections, and again, we're doing it for aesthetic reasons only, but as an added benefit, you may notice when this muscle is more relaxed, you're not grinding your teeth. I do believe that this is probably most likely covered by insurance, so that if you do have teeth grinding issues, you can reach out to your provider. And I believe neurologists can inject that. Dentists can as well. Botox is also used in the hairline or in the back of the head, which we don't do here, but neurologists do for migraine headaches. In order for us to know where this gets injected, is we make a really low line, about like that. We don't want to come with Tox any higher because that can kind of leak out into the muscles that are above this, and those muscles are responsible for smiling, so we don't want to affect the smile. We just really want to kind of focus here. Some people will draw a line here, others even draw a line over to the mental crease to kind of give themselves less of a space to work in, and that's considered safer. When I touch, I can really feel. And this muscle usually is treated with a 3-point injection, and we go pretty deep into the muscle. We're going to do on the right side. As we move lower on the face towards the neck, some signs of aging on the neck are caused by this platysmal muscle. When it gets activated, that really triggers the aging of like the lower face and the neck. How do we know what to inject? When we make this face, most people don't make this face all the time. Some do. And you can see that the platysmal bands are activated. By injecting the platysmal bands, that will relax the neck muscles and will make the neck look younger because it's more relaxed and not as activated. So we're going to inject these as well. As we move higher on the neck, there is a technique, it's called the Nefertiti technique, where Tox is injected into the slower part right along the bone, right there. So we're going to do treatment injecting right there, and there's usually 4 or 5 injection points that we can use on this lower part. What that does is kind of tighten the tissues up. It moves this up. Why does this move down? A number of reasons: collagen loss, gravity, fat pad migration, but just increasing the tone here will kind of bring this up. Some of the expressions we make are very subtle. This is kind of one of them. If people animate with their lower part, you can tell the things are kind of getting pulled down. So we're going to do that to see if we can bring this contour a little bit up. Personally, for me, I don't feel like I need to do it. I guess I'm just doing it for educational purposes, just so that you can really see all the places where toxin can be injected if this is a problem area for you.